Chapter 14, Substance-Related and Addictive Disorders. Substance-related disorders are composed of two groups, substance use disorders, and second is the substance-induced disorders. So first we'll talk about our substance use disorders. So addiction is a compulsive and chronic requirement. So this is a disease. So I want to make sure we start off knowing that this is a disease like any other physical disease or illness. In this disease, they are compulsively or chronically requiring this substance. The need is so strong as to generate some type of physical or psychological stress if that need is not fulfilled. So the diagnosis is also found in the DSM-5 manual, just as we find our other psychiatric diagnoses. So the addiction can be to any specific substance such as alcohol, cannabis, hallucinogens, inhalants, opioids, sedatives, tobacco, stimulants. The individual is considered to have substance use disorder when the substance interferes with their ability to fulfill role obligations such as work, school, and home responsibilities. Often, the individual would like to cut down or control the use of the substance, but they are unable to do so. So they have failed attempts, and the use of the substance continues to increase. So substance use disorder is also abbreviated SUD. So the use of these substances are often interfering with the person's interpersonal relationships. They sometimes will become isolated. They may engage in risky behaviors, and they will start to build tolerance, requiring increased levels of the substance. And with discontinuation or the lack of the substance, they may develop some symptoms, some physical withdrawal symptoms. Now we'll begin substance-induced disorders. First, let me define intoxication. Intoxication is a physical or mental state of exhilaration and emotion frenzy or lethargy and stupor. Substance intoxication is the development of reversible syndromes following an excess use of the substance. These symptoms are drug specific and occur shortly after ingesting the substance. Judgment may be disturbed, resulting in inappropriate and maladaptive behavior. Social and occupational functioning are impaired. Substance-induced disorders continued. So let me define substance withdrawal. So substance withdrawal is the physiological and mental readjustment that accompanies the discontinuation of an addictive substance. The substance-specific syndrome includes clinically significant physical signs and symptoms, as well as psychological changes such as disturbance in thinking, feeling, and behavior may occur. Here are the classes of psychoactive substances, and we'll discuss them a little more in detail later on. We have alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives or hypnotics, stimulants, and tobacco. And as you can see, some of these are legal. Genetics appear to be involved in substance use disorders, especially alcoholism. Children of alcoholics are 4 times more likely than other children to become alcoholics. So evidence supports the idea that changes in the brain structure and brain neurochemistry occur in the process of developing an addiction. So our psychodynamic approach believes that individuals with primitive super egos turn to drugs to diminish unconscious anxiety and feelings of power and self-worth. So if you remember Freud's theory. So it talks about the punitive self-ego. Also, it is believed that the psychological factor that can influence addiction is a fixation on oral stage of psychosexual development. Predisposing factors continued. So psychosocial factors, we have our personality factors. That's our low self-esteem individuals with depression, passive, antisocial, inability to relax. Then these are factors that are may increase their likelihood of addiction. Then for cognitive, we have irrational thinking patterns that have long been identified as a problem for our people struggling with addiction. Social cultural factors. So families appear to be an important influence in substance use. Various studies have shown that children and adolescents are more likely to use substances if they have parents who provide a model of substance use. Social cultural factors continued. So we have conditioning, and conditioning is a term used to describe a learned response that occurs after repeated exposure to a stimuli. Substance abuse can become a learned response from the substance abuse itself. Then we have our cultural and ethnic influences. So some cultures are more prone to substance abuse than others. Alcohol has a depressive effect on the central nervous system, resulting in behavioral and mood changes. We have 4 different phases, and we'll go over those 4 in the next 2 slides. First phase is our pre-alcoholic phase. This phase is when alcohol is used to relieve everyday stress and tension of life. The thing is, with this phase, the tolerance starts to develop and the amount required starts to steadily increase. Then you have phase 2, so the early alcoholic phase. In this phase, the patient starts to have blackouts. Alcohol is no longer a source of pleasure, but is rather that a drug that is required. They are secretly drinking, sneaking to drink, preoccupied with maintaining alcohol, and they are rapidly gulping down the drink. So we have phase 3, the crucial phase. So the person has lost control. They are physiologically dependent upon alcohol, and they will become extremely ill without it. Phase 4, the chronic phase. This individual is characterized by emotional and physical disintegration. The person is usually intoxicated more often than sober. They may start to have feelings of depression and suicide. The heavy drinkers, stopping abruptly could be a fatal um, task. In addition to, they may have impairment, psychotic impairment. They may also have some physiological, life-threatening manifestations in their body. So there are several slides that talk about the effects of alcohol on the body. So for your peripheral neuropathy, you may have nerve damage, pain, burning, tingling, prickling sensation. Alcoholic myopathy can be acute or a chronic condition, and the person may experience pain and swelling or weakness in their muscles. These symptoms are usually generalized, but the pain and swelling may be involved in the calves muscles. Wickernese encephalopathy is one of the most serious forms of thiamine deficiency in alcoholic patients. Some of the symptoms include paralysis of ocular muscles, ataxia, stupor, and the treatment is to quickly replace the thiamine. Then we have Korsakoff psychosis, which is identified as a syndrome of confusion and loss of recent memory. Treatment is also thiamine replacement. Alcoholic cardiomyopathy generally relates to congestive heart failure or arrhythmias. So the effects of alcohol on the heart is a accumulation of lipids in the myocardial cells, resulting in enlargement and weakened conditions. So treatment of the CHF or congestive heart failure patient may include rest, oxygen, sodium restriction, diuretics. The death rate is high for individuals with advanced symptomology. The patient may experience esophagitis, which is inflammation of the esophagus. It may also experience gastritis, inflammation of the stomach lining, causing them gastric distress. Pancreatitis may occur in acute or chronic. Acute is usually after 1 to 2 days of binge drinking, um, and it will lead to gastric pain and gastric symptoms where you have your chronic, which leads to weight loss, diabetes. So see your book. The patient may also experience alcoholic hepatitis, which is caused by heavy use of alcohol. They will have gastric symptoms. They may lose weight. They may become jaundice, have a fever, and have gastric symptoms, enlarged liver, tender liver. Cirrhosis is the end stage of alcoholic liver disease. So the liver cells are destroyed and replaced with scar tissue. Here are some complications related to cirrhosis of the liver due to alcohol. So portal hypertension, which is elevated blood pressure in your portal circulation due to the diseased liver. Then you have ascites. Ascites is accumulation of fluid in your abdominal cavity, which also is a response to the portal hypertension. Then you have esophageal varices, which are distended veins in your esophagus. These veins may rupture, causing hemorrhage and sometimes death. And these veins become distended due to the poor portal circulation related to the sclerotic liver. And then you have your hepatic encephalopathy, which is a serious condition that can result in death or a coma. So your diseased liver can no longer convert ammonia to urea for excretion out of the body. Therefore, ammonia levels begin to rise in the body, causing mental confusion, depression, sleep issues, and again can result in coma or death. So other effects of alcohol on the body include leukopenia, which is impaired production and um, functioning of your white blood cells. Then you have your thrombocytopenia, which is the impaired production of the platelets and impaired survival rate of the platelets. And then you may have sexual dysfunction, both short term and long term. So for long term, the effects include gynecomastia, which is just enlarged breasts on men, sterility, impotence, decreased libido. And our short term is our enhanced libido, and failure of erection is often common. So prenatal exposure to alcohol can result in a range of disorders for the fetus. And the range is known as fetal alcohol spectrum disorder, or FASD. The most common of these three that are mentioned on this slide is our fetal alcohol syndrome, or FAS. That is the most common. So fetal alcohol syndrome includes physical, mental, behavioral, and learning disabilities with lifelong implications. So then we have other fetal alcohol syndrome disorders, and they include alcohol-related neurodevelopmental disorder and alcohol-related birth defects. So there is no amount of alcohol that is safe to be for the mother to consume when she is pregnant. And these two disorders, the child may develop problems with their heart, kidneys, bones, or hearing, according to CDC. Characteristics of fetal alcohol syndrome include learning disabilities, speech and learning delays, intellectual disabilities, poor reasoning, sleep and sucking problems, vision and hearing problems, problems with your heart, kidneys, and bones, facial abnormalities, small head, shorter than average height, low body weight, poor coordination, hyperactive behavior, difficulty paying attention, poor memory, and difficulty in school. Alcohol intoxication and withdrawal. Alcohol intoxication occurs at blood alcohol level between 100 and 200 milligrams per deciliter. Alcohol withdrawal occurs within 4 to 12 hours of ceasing the use of heavy alcohol for a prolonged period.